Good morning to you and the audience that tunes in every morning. The beginning of our briefing today is sad because we have to convey our heartfelt condolences to four families, groups of friends, because regrettably we have to report today the death of four people. We're talking about an 83-year-old male patient from the municipality of Camajuaní in the province of Villa Clara with a pathological history of high blood pressure, ischemic heart disease. He was also bedridden. He was admitted for 6 days after having started with respiratory manifestations, much weakness, and anorexia. And after a stay of 2 days in the intensive care unit, he presented a group of complications, deterioration of consciousness. It was necessary to intubate him and ventilate him, and unfortunately, yesterday he went into a cardiorespiratory arrest from which it was not possible to bring him back to life. We very much regret the death of this gentleman yesterday. We also have to lament the death of a 79-year-old male patient from here in Havana province, the municipality of Guanabacoa, with a history of high blood pressure, ischemic heart disease, cerebrovascular disease, and esophageal neoplasm. He is a patient who was also bedridden, who unfortunately was taken a little bit late to the hospital and could not be resuscitated due to the degree of complications that he was taken to the hospital. Right after his arrival, he had a cardiorespiratory arrest, and though efforts were done to try to resuscitating him, it was not possible to revive him. A 94-year-old female patient from San Miguel del Padrón in Havana. She died with a history of bronchial asthma, dementia, and long-term bed rest. She was admitted to the hospital for 4 days, and also she developed a group of complications from which it was not possible to save her. She had respiratory problems with many complications, and ultimately yesterday she went into cardiorespiratory arrest, and it was not possible to revive her. And we're also very sorry, and we give our condolences for the death yesterday of a 92-year-old patient from the province of Sanchez Spiritus with a history of ischemic cardiopathy and senile dementia, who remained in hospital for 5 days and 2 days in the intensive care unit. Which also had many clinical complications, and yesterday he presented an acute myocardial infarction, and with the complications he already had, it was not possible to revive him either. We very much regret the death of these four people yesterday. Despite the efforts of our professionals using the established therapeutic procedures, but the complications that they developed did not make it possible for them to recover. We have to report as well that among the patients admitted to our hospitals diagnosed with COVID-19, we have 5 in critical condition, 1 more than yesterday, and 3 in serious condition, 7 less than yesterday.
Uno está en el Hospital Militar Fermín Valdés Domínguez de Holguín y uno en el Hospital Joaquín Castillo Duran de Santiago de Cuba. Pasó de grave a crítica.
Today we are reporting 2,370 patients admitted to our hospitals, 29 in surveillance, suspects 1,718, and 623 confirmed. 6,362 people are under observation by the primary healthcare system. Yesterday, 1,965 samples were processed to detect the presence of the SARS-CoV-2 and the COVID-19 disease. At the Pedro Curie Institute of Tropical Medicine, 785, at the Molecular Biology Laboratory of Havana, 347, in Villa Clara, 290, in Santiago de Cuba, 281, in the Brother Ameijeras Hospital Laboratory, 133, in the Civil Defense Laboratory, 81, and at the Genetic Engineering and Biotechnology Center Laboratory, 48 patients. As a result of analysis of these 1,965 samples, 26, that is 1.3% of the samples, tested positive. The 26 cases confirmed yesterday were Cuban, 23 of them, or 88.4%, were contacts of confirmed cases, bringing to 1,478 the number of confirmed cases in Cuba. 85.5% are people who have been related to a person who was already confirmed as a positive to COVID-19. Hence, the importance of surveillance, the admission, which at times is not well understood by people who present no symptom of the disease. These people are hospitalized because they are a contact of a person who was confirmed with the disease. So, as I said, 1,478 people, 85.5%, are contacts of confirmed cases. Yesterday, in 3 cases, the source of the infection could not be identified, and to date, the country accumulates 81 cases. That is 4.7% of confirmed cases whose source of infection remains unknown. 129 cases have a source of infection abroad. Of the 26 new cases, the largest number, that is 53.8%, are female. At present, the female sex amounts to 48.6%, that is 841 diagnosed patients are female. 12 male patients tested positive yesterday for 41.1%. However, in the cumulative total, male patients have a higher number with 51.4% of the cases. Yesterday, of the 26 diagnosed cases, 16, that is 61.1%, were asymptomatic. And we always take the opportunity to highlight the importance of the subject from the prevention point of view. If we believe that we are going to get infected from a person, only from a person who is coughing or is sneezing, that's wrong. We can get the disease from absolutely anybody who shows no symptoms at all. To date, all of the confirmed cases in the country. Of the 1,729 cases, 61.5% were asymptomatic. Of the cases confirmed yesterday, the age groups more affected were those younger of 40 years, with 13 cases. Followed by the 40 to 60 years of age group with 26.9%, and over 60 years with 23.1%. If we combine these two last groups, patients older than 40 account for 50% of the cases. The province in which the highest number of cases were confirmed yesterday is yesterday it was Havana with 13 cases. 6 cases were reported in the Havana del Este municipality, 2 were from San Miguel del Padrón, and 2 were from Marianao municipality, and 1 case each from Havana, Havana Vieja, Centro Havana, and Guanabacoa. Of the 1,729 patients diagnosed with the disease in our country, 615 have a stable clinical evolution. They represent 98.7% of the active cases we have today. As I said at the beginning, we regret the loss of 4 people yesterday. So that adds up to 73 deaths since the beginning of the epidemic in our country. That gives a lethality rate of 4.2% of the diagnosed cases in the country. It must be said that in the Americas region, to compare it with our country, Cuba today ranks number 13. That is, there are a total of 12 countries that have a higher percentage of lethality than the island. We have the 2 evacuees, and there have already been 1,031 discharges, 30 of them yesterday. That is to say, 59.6% of the cases that have been diagnosed in our country have been discharged from health units, and some of them are already working. As you can see, today is yet another day in which the number of discharges, which are 30, exceeds the number of confirmed cases. When we see that in the graph of the curve or of the peak, we unquestionably continue to go down, and we hope that with the effort of all and the fulfillment of all the measures, which is still not much appreciated as it should be, we will achieve the reduction of the number of cases even more. In terms of the migratory flow, yesterday 122 travelers entered our country. 121 of them are Cuban, who, as I said, were abroad when the COVID measures were taken, and they returned yesterday. There was a foreigner who is not a permanent resident, 2 who were on an official mission, and all of them flew in from Mexico. Also yesterday, 105 people left, including foreigners who were here and immigrants. Thus, there are still in Cuba 10,981 visitors, including 6,634 immigrants and 4,347 foreigners. In rental houses, it's not even worth mentioning. There is a similar number, 953, and they are staying in the same municipality. Santiago, Plaza, Centro Habana, and Playa does not have much movement. From the international point of view, as of May 6, the situation in the world was very complicated. I was watching the news, and it all reiterates the complexity of the situation, and you can see that in the different news services. And 184 countries are confirmed with cases of COVID-19, with a total of 3,623,803 confirmed cases, 79,581 in one day, and a cumulative total of 255,880 deaths, with 5,903 in a single day that died yesterday. This implies a worldwide lethality of 7.09%. In the Americas region, there are already 1,553,845 confirmed cases, 39,917 more than yesterday. The region of the Americas already represents 42.9% of the total number of reported cases in the world, with a total of 90,566 deaths, 3,334 on a single day, and lethality, as I said earlier, of 5.78%, higher than yesterday. We do not want to finish this without referring to the positive rate in our country. The special municipality of the Isle of Youth, with 50.4 per 100,000 inhabitants, remains in the first place. It is followed by Habana with 38.5, Villa Clara for 26.5 per 100,000 inhabitants, Ciego de Ávila 19.9, Matanzas 17.6, Sanchez Espíritus 14.4, Mayabeque 12.5, Holguín 9, Pinar del Río 8.6, Artemisa 6.2, Cienfuegos 6.9, and Camagüey with 5.1. This is the situation of our positive rate that we had in our country until yesterday.